Dogs have been domesticated by humans for centuries, so most breeds these days have a particular look, very specific to their function. Needless to say, most of these are very far removed from their original wolf ancestors. So it shouldn't come as a surprise that with these altered physical characteristics, we are also finding some common conditions prevalent across certain breeds. Whilst not all dogs of a certain breed will experience these conditions, it's vital that owners understand what they may need to be covered for and at what level to ensure that they're covered for any treatment or surgery that may be required. Little pugs like Chance here can be prone to oversized palpebral fissure syndrome. In other words, having excessively large eyelid openings. This can lead to blindness, so it needs to be monitored constantly by your vet. You don't have it though, don't worry. Cavaliers, on the other hand, can be prone to dry eye and also cardiac disease. These can both be treated, but again, they need to be monitored. Staffies can be prone to dermatitis, while dachshunds with their long backs can suffer from intervertebral disc disease. Labradors, like Ronnie here, can be prone to hip and elbow dysplasia as well as ear problems, but yours are looking okay. Yeah. That's why it's important with these and all the other problems we've mentioned to take out an insurance policy as early as possible before any of the symptoms present themselves. What do you think? Yeah.
I often refrain from screening them, have you got insurance or not, but it's a deal maker and a deal breaker every single time. In fact, we've got a case in this morning I was dealing with, a cat, not a dog, but it's got a seemingly trivial injury. It's got a luxated knee. And I've been through the options multiple times over 2 phone calls, very stressed male owner, and they've actually elected to euthanise. One of the options was to amputate, and I said amputation's actually more expensive than fixing it. But they've made a decision to let their cat go. It's a 4-year-old cat, everything else is normal. So that's devastating for them, the cat and the veterinary personnel.
I mean, I know how I feel when I'm put in that position. How do you feel?
I'm a bit of a sucker for a deal, so often I will offer them a discounted surgery. I mean, a lot of surgeons do that, come to the party, so to speak. You know, I would euthanise less than 10 animals a year in that predicament. That's fortunate, but this is not why you went to vet school to train, to euthanise animals that can be fixed. I mean, it's a fixable problem. The surgical solution's not the barrier, it's the client's finances and also, in this particular case, fear of things, post-surgical complications. They're not only budgeting for the fixed costs of the surgery, but what else might go wrong if it doesn't work. So they almost need a built-in plan B. Obviously, insurance is the answer to all this. That's why it's so important to understand your dog's breed and to make sure that you have the right level of coverage that they may need throughout their life.